Welcome to Michigan Reimagined, presented by Good Marketing and Wagoner Financial. And here's your host, Chris Buck.
Society is clamoring for healthcare reform, along with a fundamental shift from sick care to truly affordable healthcare. Here to discuss an upcoming event called Healthcare 2026 is the founder and CEO of Health Baar, Nathan Baar. Welcome back to the show, Nathan.
Good to be back, Chris.
Yeah, right on. All right. So for those who haven't heard your message, can you summarize your concerns about healthcare in the United States?
Yeah, I think more and more people, luckily, have been hearing the message. But really the idea is, how do we create a healthcare system that is incentivized by healthy outcomes, that is less focused on monetizing sickness, and really almost shifts the pendulum back to independent practice and autonomy and community-based healthcare. And so we fight many of the trends that are pushing our current system forward, and fight, and more so, we're just trying to create new and give people option.
Got it. And what's your personal background?
I'm a registered nurse by my original training, worked in the ER, climbed the corporate ladder. I was a director in a health system, and saw all the elements of how healthcare runs. Was put off by many of those, developed some ideas on how to create solutions for that. And so Health Baar was born in May of 2020, and I haven't looked back.
May of 2020.
Yeah, it's crazy.
It's kind of a weird time to do it, but that's a long time ago now.
Crazy time. Huge part of our story for other conversations that we've had in the past.
Yep.
And but formative for me as a person, as well as how we launched as a business. And a lot to be thankful for, despite even some of those very, very hard times.
Understood. So for those listening, I've had Nathan on a number of times to talk about the origins and the deeper dive where the interview is strictly about what Health Baar is. But in a nutshell, can you just give us how are you different than a healthcare provider than the traditional sense?
Yeah, we're creating, we would say, scalable, independent primary and preventative care. So, and we're innovating in how it's accessed. And so we're putting care where people are again. So in employers and schools and communities, we're changing how it's paid for. So we're shifting to more of this capitated payment, value-based care model versus this fee-for-service sickness model that we have. So you hear a lot of these buzzwords in the health systems, but then we keep doing the same thing over and over again. And so we're really trying to embrace those alternative elements. And then not just looking at healthcare or interacting with your clinical provider when you're sick, but how do you see healthcare for more of a preventative and optimization strategy? So in our medical philosophy, we say we take the best of Western medicine, which is that sick care, and we blend it with a very heavy dose of behavioral and functional medicine. How do you optimize your body's functions to be its best healer? And so that's through basic things like sleep, like hydration, movement, mindfulness, breathing techniques, all these things that sound kind of
getting outside.
Yeah. But I think we're bringing legitimacy to it and showing that these things done over time and through continuous habits make a big impact in someone's life. And if your medical provider is the one who's coaching you through this, it's a perfect blend, because you can take care of some of that acute and chronic and other things that have maybe accumulated in your body over time. And then we work with you to reduce some of those things and then build habits that can really reduce your dependency on us. At the end of the day, like, we don't want dependency on
healthcare.
us.
Be healthy.
Exactly.
Don't need your doctor to have a reasonable lifestyle.
That's right. So yeah, trying to kind of flip the script on how you see your clinical provider and your relationship with that provider, and just make it normal again, right? It seems like this big to-do when you have to go to the office and see your doctor, get a check-in, you have to sit there for an hour and you see him for 5 minutes. And this feels very transactional. How do we make it so it's a relationship again, where that person actually knows you?
Right. Okay. You talked about the origins and the time when you got started, but what kind of geography does Health Baar serve these days?
We've expanded quite a bit. We're primarily Michigan, headquartered in Grand Rapids, Michigan. Our model is meant to be scalable and expand across the U.S., hopefully. So we're starting that journey. We're in Illinois now with an on-site population, in Ohio and Alabama as well, and soon to be Pennsylvania. So physical presence of clinical services in those various states. Now that's smaller and growing, but still there. And then virtually caring for people in 36 different states. And virtual is kind of an assumed thing you have to be able to do as an individual nowadays. So,
well, telehealth has been a thing for a while. So
correct.
Good for you. Okay. And I had one other thought. How, just before we get into the event that you're hosting, talk a little bit about how people can learn. If they're intrigued by what we've said so far, how can they learn more about Health Baar?
Yeah, probably the easiest way to understand what we do, how we do it. It's complex. I'm active on LinkedIn, so follow me on LinkedIn. Kind of get an idea for the why behind the business, and maybe get some valuable insights as to the current healthcare industry that you may not be privy to just by reading basic news stories.
And he's not lying, and his name is Nathan, Baar.
Yes, correct.
Nathan Baar. Follow him. It's worth the follow.
Yeah. And then healthbar.com, and we have various resources out there to learn more about the business.
Got it. Okay. Well, I want to tip the cap to our friends at Good Marketing. Here at Michigan Reimagined, we tell stories of passionate Michiganders doing great things across the state. Today's podcast sponsor, Good Marketing, helps organizations tell those stories in powerful and measurable ways. As a behavior change accelerator, Good partners with mission-driven clients to inspire action, shift mindsets, and strengthen communities. From advancing affordable housing to protecting natural resources and expanding education and workforce opportunities, their work moves Michigan forward. See how they're helping shape Michigan's future at goodmarketing.com. That's GUDmarketing.com. So, healthcare 2026.
Yeah.
You are barreling towards a conference, a convention, as it were, of like-minded. Hopefully, I would imagine the attendees and people are going to be a little bit more towards you, or do we have traditional healthcare folks attending as well?
Yeah, I'm a glutton for punishment. So I'm always a believer in be the change you want to see.
Right.
Just get out there and do it. And if you fail, learn and keep moving forward. I'm not afraid to fail. I failed in my career. And really, kind of what happened was actually Health Baar put on, we call it the Health Baar Healthcare Summit in the spring of 25. And just really the idea of how do we create a forum for clinicians to come together and be fed and empowered and educated in more of this health-oriented space.
Yep.
And to really say there's another way of doing healthcare out there. We invited all of our Health Baar team, invited external clinicians to this. Had a decent amount. I think we had about 125 people show up total, so a good launch. And we found there's a huge appetite for it.
Right.
And as Health Baar's been growing, what we've found is that we're acting as the central primary care hub, right? So we're kind of that first stop with someone's healthcare journey, and or integrating them into our model versus maybe another model. What we found is there's a lot of other independent players in the healthcare ecosystem that are trying to find out how do we get access to those patients. They do really good services. They're very competitive in pricing, much cheaper in pricing than maybe a traditional system or a large vendor that may exist out in the ecosystem. So how do we bring visibility to them as well? So they're doing great work, but they're kind of out here, entrepreneurs themselves, trying to carve their own paths. And so I was like, what if we took the momentum that we built with this healthcare summit, this focus that we've built on health, and the momentum we're feeling from these other service providers in these various areas. You think of, PTs and chiros and independent radiology providers and direct primary care and these different sources. And what if we created a space for them to come together and to really collaborate and learn and to be hopeful? Sometimes you're in these journeys and you're an entrepreneur or a business owner, and you're looking out there and you're like, man, it's like, it doesn't look good, right?
I'm all by myself.
All by myself.
Yeah.
And is there anybody else out here who thinks this way?
Right.
And I'd go to healthcare conferences, and it's kind of the same stuff, right? I'm always hearing from the big players, the hospital systems and the payers, and pay to play. People are there and they get to speak because they paid to speak. And it's like, how do you give opportunities for the small guys to speak? They have good things to say, but they don't have the finances or the clout. And so all of that kind of came together. And I was like, let's just do a conference. We have great event space in Grand Rapids. We have so much desire in the market for something like this as I'm having these conversations. And I really think that if we put together the right speaker lineup, if we brought the right players together, that I think some really cool things can happen. And so I think sometimes it's just about bringing people together and then seeing what happens, right? And so I just started putting the foundation behind it, and healthcare as a conference was born. So we put health in parentheses or quotes,
right?
Because the idea is like we have a healthcare system, but it's kind of a sick care system that we have.
Right.
can we create a parallel healthcare system that's incentivized by healthy outcomes? Because there's really almost a disincentive for the traditional system to get people healthy, because it's kind of cutting off their revenue legs at the end of the day.
Right.
So they're building, billion-dollar facilities, and they're investing a lot in infrastructure. It's just a business, and you have to pay for it, right? So where does money come in healthcare? It comes from sick people. So
Right on.
Yeah.
Well, I'm looking at the tagline. I went on the website. It says, bringing together leading voices in healthcare, entrepreneurship, AI, content strategies, and hospital payer transparency. And I'm really excited to kind of unpack a little bit about who the speakers are and the attendees are. But because I think we're going to get deep into this, I want to give a nod to our friends at Michigan Rise. This episode is brought to you by Michigan Rise Pre-Seed Fund, providing early stage funding to Michigan-based startups. Since 2020, Michigan Rise has helped high-tech, high-growth startup companies achieve commercial and technical milestones through capital formation strategies, talent development, and customer acquisition tactics. With financing options for every stage of the entrepreneurial journey, Michigan Rise significantly increases the impact of new ideas and research. Visit MichiganRise.com to discover how Michigan Rise can help fuel your startup's growth. Michigan Rise is supported by the Michigan Economic Development Corporation and the Michigan State University Research Foundation. All right, so you've got a date set in the calendar. When is that?
April 1st. It's not an April Fool's joke.
So it is actually happening.
It's actually happening.
Okay.
And
where?
It's going to be at DeVos Place, downtown Grand Rapids. The night prior, we're having a kind of a VIP dinner event, meet the speakers, doing that, more of an intimate experience. Unfortunately sold out, but maybe next year. Put that on your calendar. And then April 1st, Wednesday, is the conference day. It's going to be around an 8 a.m. to 5 p.m. style conference. Action-packed. We're keeping, knowing it's only going to be a day to start, and knowing that hour-long, presentations can get long. Really trying to keep the content with this to be practical and applicable and inspirational for our attendees. So clinicians attending, pouring into them with alternative ideas on how healthcare can be delivered, whether it's care delivery models, functional medicine philosophies, whether or not it's content strategies for LinkedIn. I have a couple of my LinkedIn connections, Sims Tillerson and Tiffany Ryder, coming in from other areas of the U.S. to really empower our attendees and optimizing their social media presence. It's such a huge part of building a business nowadays,
right,
is getting your message out there. It's been critical for me, and so I believe strongly in it. So a content workshop on that. Another one of my LinkedIn connections, Preston Alexander, is a company called /Health. But he has really been able to break down from a hospital finance transparency how hospitals will put out their financial data, and maybe they'll say, "Oh, we're losing money. There's struggles, most definitely, with many things happening with the Medicare and Medicaid payer space and those different dynamics. But a lot of these are accounting tricks at the end of the day on paper. And so cash positions are increasing, but their bottom line shows a deficit for all these different write-offs that they get to have. So super interesting information. And I think giving people knowledge and an understanding, as well as insight into alternative ways of doing things, can really unlock a lot of entrepreneurial potential. But really looking at mainly 30-minute style presentations, pop, high-level content, super value added. And
it seems like the hallway conversations and the lunch breaks and all that kind of stuff are going to bear probably almost as much content and fruit as the presentations themselves.
Yeah, if you think about the attendees, there's probably going to be 60% attendees are going to be clinically oriented or focused. So business owners, independent clinicians, interested and curious clinicians from the health systems wanting to learn more. You're going to have business owners there who are curious about what's happening in the independent healthcare space as they're looking at their benefit strategies. Insurance agencies looking for creative strategies, and even capital partners will be there and looking at what's up and coming in the healthcare space. So it's good. It's going to be a diverse set of attendees, really all oriented around this independent healthcare ecosystem. We call it a parallel healthcare ecosystem that we're putting some structure to and trying to be a centralizing voice in that. We're trying to get away from this idea, and as you start a business, you always are oriented towards your competition sometimes. It's like, who's out there competing against me and how do I beat them? And I've tried to adopt the mindset and push the mindset of healthcare is such a big issue across the U.S. that no one company is going to solve for this, and no primary care group is going to solve for this. No PT group is going to solve for this. Healthcare is a dynamic ecosystem that involves all the players. And so how do we get away from this tribalistic, feud that we might have as competitors,
right?
And really look at each other and say, we're all on this journey together. Let's work together to do this.
Right.
And so I think a more collaborative voice in this parallel healthcare economy can start really gaining momentum, and with the right mindset of together.
So, thinking about this, it seems like, at least this iteration, and maybe I'm wrong, like you said, the audience and the attendees, it's all kind of like-minded people that are in this space finding a safe haven to just find validation and, get tips and tricks on how to just, I'm dealing with this problem. I dealt with that last year. Here's what you want to avoid doing, and here's what I would do again if I had to do it again. So it's kind of peer-to-peer and just kind of, building up the, girding your loins as a group of people, as opposed to collectively sharing this concept with almost third-party people who are unaware that this revolution is kind of happening. Is that fair to say?
Yeah, I think version 1 is going to be a lot of those internal stakeholders who are just coming together to really understand what's out there and how to learn from each other. I think version 2 in the years beyond, so this is Healthcare 2026, we hope to have Healthcare 2027, 2028, and beyond. I think the idea is, how do we create a nucleus with this initial conference? Find a core identity. You go forward with a thesis, and you hope to prove it out with any scientific method or business venture. So everything up to this point has been validated fairly well, great interest, all those different things. We'll put the conference on, and maybe I'll fall on my face. But
how can that happen?
I
don't think, it seems like if you have a very loose run of show, a place for people to park and show up and hang their coats, and then you've got people teed up to speak,
it'll be fantastic.
Yeah, there's no way that the content won't deliver.
No, it'll be fantastic. I have very, very high hopes. And I do think that people coming off the heels of this, just like we came off the heels of our initial summit in 25, will really see the potential for it, and we'll already start planning for the following year after that, and really try to get it to be a broader medical audience that needs exposure to this, not just reinforcement or validation, but this is people who are eyes are opening completely to this world. Yes.
So I would say probably 99% of my listeners and people listening right now are not going to attend your event. But I think it's important for the world to know that this is out there, because again, whether you're in the space as a human on the planet, you have a dentist and a primary care physician most likely, and you probably will break a bone or have a cold or catch COVID or whatever that thing may be.
Yeah.
And if you have any concerns about your healthcare costs and the evolution of where things are going, it's just interesting, I think, to know that this phenomenon is occurring. How can people, I went on the website, share with the world what the Healthcare 2026 website looks like.
Yeah, so just go to healthcare2026.com, and what you'll find is some different perspectives. You'll see speaker lineups, you'll see the agenda. You're going to get a good flavor, I think, for what it will be. If you're curious and would like to attend, please do. You can register right there online. We have a few sponsorship slots still available, so good ways to still get connected. But if you're curious, just reach out. Let me know. You can send a message to kind of our organizing committee for the event, and we're always willing to answer questions and for people involved. But I think what you said is super important, is that just for people to be aware that work is being done, and that things like this cannot be overnight successes, and to solve some of the problems that we're solving take time. And so know that the work is being done. And if you know of other healthcare entrepreneurs or independent businesses out there that might be interested in this, send them our way, get them tagged in. We want everyone there. So there are people out there that do not know about this, and we'd love to spread the message. Got it. So healthcare2026.com. And Health Baar with one A. With one A. Health Baar, BAR.com is for your own private business. Yep. And then following Nathan Baar, BAAR, on LinkedIn will give you a very good flavor on your disruptor plan, professionally, but certainly, as you mentioned, poking the bear a little bit on some articles that are published by big healthcare providers with the woe is me kind of bent to it a little bit, and you bringing up some other counterpoints as to maybe why some of that isn't as... Yeah, I think people need perspective. They need to hear all sides of the angle, make an informed decision after hearing and seeing multiple sides of things. And so I'm a
Right.
big believer in everyone makes their own decision, but give me the information, right?
Right on.
And go from there.
Wonderful. We've been speaking with the founder and CEO of Health Bar, Mr. Nathan Baar. Really appreciate you spending the time. Best of luck on your event. There's no way it's not going to be a success, and I will keep my eyes on social medias to see some of the fallout and aftermath. And I'm sure you'll post summaries and pictures and kind of a closing, post about how it all went.
Always.
Wonderful. All right. And I'd love to give a final shout out to all my loyal sponsors, Wagoner Financial, Good Marketing, Triterra Environmental, Keller Williams Advantage and Team, Michigan Rise, Kirk Byron State Farm, and the attorneys at Foster Swift. Great people that are worth the call. And if you found the show as a one-off, I want to remind you to follow and subscribe to Michigan Reimagined on YouTube, Facebook, Apple Podcasts, Google Podcasts, Spotify, iHeartRadio, and pretty much anywhere you find your podcasts. This is Chris Buck signing off for Michigan Reimagined.